Good afternoon. Is everyone ready? Very good. Well, as you've already heard, there's no new cases of COVID-19 in Queensland, either in hotel quarantine or in the community, meaning we have just 17 active cases here in the state. We did 8,022 tests in the last 24 hours and 17,667 vaccinations at Queensland health clinics, including 148 people who got vaccinated on their way into the footy at Suncorp Stadium and 179 people who got vaccinated seeing the rugby in Townsville. That means we've now got more than 2/3 of eligible Queenslanders having had their first dose, 63.39% and 44.51% of Queenslanders are now fully vaccinated against COVID-19. And today we step our campaign to get Queenslanders vaccinated up a notch. Until now, we've been limited by supply in terms of how many people we could vaccinate. Now that we have larger supply, we can get that message out and get more people vaccinated. And so we're launching a brand new advertising campaign designed to encourage Queenslanders to come forward. Now that most of those who are eager to get vaccinated have been vaccinated, we just want to get the message out to more people that there is vaccine available for them. And more importantly, that once we are all vaccinated, we can do more of the things that we love. The campaign is called the Things We Love campaign, and it's all about the fact that throughout this pandemic, we've all had to go without lots of things that we love. And so it's not so much about wanting a vaccine, it's about wanting to get back to the things that we love. And for me, craft beer and a Sunday session is one of those things. It's great to be here at Easy Times Brewing Company in Woolloongabba. A mate of mine helped open this place 12 months ago, and this has been my first chance to get here. So this is the length that I have to go to enjoy some of the things that I love. But this campaign is all about saying to Queenslanders that if we all go and get vaccinated, then we can all get back to doing the things that we love. I'll ask the Chief Health Officer.
Thank you, Deputy Premier. Yes, so no new cases in Queensland today, but there are still some people who are in quarantine at home related to our last outbreak, and I thank them very, very much. It must be extraordinarily hard. They've already done 14 days, and like that young child yesterday, they're having to do more because someone in their household has tested positive. And whenever someone in a household tests positive, then everyone else starts their quarantine again. So thank you very much to all of those families. And thank you to all of the Queenslanders who've now gone through hotel quarantine or home quarantine, sometimes both. Thank you for what they've done. And by all getting vaccinated, we'll be able to stop that requirement for those lengthy periods of quarantine. So it's absolutely critical. So we've seen large numbers of people come out and get vaccinated. Thank you very much. So there are now more than 1.7 million Queenslanders who are fully protected. That means we can see going forward 8,000 less deaths because they've been vaccinated, because we know that every single vaccine is so protective. We're seeing that down in Sydney and Victoria. It's become the pandemic of the unvaccinated. So please, if you've been hesitant for whatever reason to date, or you've just not felt the need to be vaccinated, now's the time to genuinely come out and get vaccinated. We have plenty of supplies. There is no shortage. You can go to a pharmacy and get Moderna. You can go to your GP and get AstraZeneca or Pfizer. You can come to one of our clinics and get Pfizer. So there's lots of choice out there. Now's the time to do it. It's absolutely critical. So we can move towards the end of the year and really start celebrating, a bit like we did last night. It was fantastic seeing what happened here in Brisbane last night. Thank you.
Thank you. My name's Belinda. I'm a nurse and I work on the front line at the PA hospital, and I'm here today to try to encourage Queenslanders to come out and get vaccinated. The vaccine is a safe vaccine. It's the only thing that we can do in this international pandemic to get us back to doing what we've loved to do, what we do all of the time, and get out there and enjoy our family time with family and friends. So please take the opportunity to talk to your GP if you're vaccine hesitant. as Dr. Young has suggested. If you're anxious, that's okay. Come along and have a conversation with the clinical experts that are able to explain to you the ins and outs of the vaccine, to make you have that confidence and to feel safe to get your shot. Because if you don't get your shot, you're not going to protect our community, you're not going to protect our vulnerable people. And at the end of the day, all of our healthcare workers across the nation and certainly internationally for the last 20 months have been working so hard to keep us all safe. And the next step in that process is for us all to be vaccinated. So for those of you that are vulnerable, please take the opportunity to drop into one of the drop-in clinics or to go to the pharmacy, get yourself your vaccine and keep us all safe.
Belinda, before you're underway,
Yeah.
can we ask you, as a frontline nurse, are you concerned about the virus coming in and hospitals like your own getting slammed and not being able to keep up with enough ICU beds?
I think as a general rule of the state, so for Queensland we have done exceptionally well, and we have had hospital outbreaks. They've been very small, they've been very well maintained, and that's because of all of the other principles that we put into place. Social distancing, not coming to work when you're sick, wearing of your mask, having appropriate personal protective equipment available, and having our staff cohort trained as to how to implement all of those things. So our frontline staff in the emergency department are ready for patients coming in the door. We've got border controls in place, which I can appreciate is frustrating for the general community, but it has been really important to give us time to be prepared so we don't end up, certainly like what we're seeing our state counterparts in New South Wales and Victoria.
And I guess that's what I'm asking, if we end up like New South Wales and Victoria, even if we get 80 or 90% vaccination, is that what you would fear the most as a nurse, ending up with having your ICU flooded with people who are very unwell?
I think my biggest fear is that my family and friends and my loved ones will become unwell with this disease, in all honesty. I think we're very well prepared as a community, and certainly in the hospital setting. We've been managing this and being prepared for this since, in all honesty, it was Australia Day last year that the first conversation started about the COVID-19 coming out of Wuhan in China. So I think we are prepared, and I'm confident that our ICUs are in the right space and they're ready to go.
Melinda, you've seen first-hand people with COVID and the impacts it has on them.
I have.
Do you think that needs to be more amplified, if you like, in the advertising and warnings for people to take a step and get the jab?
I think it's twofold, isn't it? Because we don't want to cause hysteria in the community, but we want people to really understand that COVID is a really serious disease. It is not like the flu. It is very, very different. And there's this concept around COVID, which is long COVID, which I'm sure you've all been looking at and reading about in mainstream media and on social media, where people have long-term effects, so their lungs just don't recover. We have had at my facility young people being infected with COVID who weren't really, really sick. They had aches and pains, terrible cold-like symptoms, headaches, terrible fevers for a good 10 or 12 days. But 12 months later, they're still having shortness of breath when they're going for a jog. When they're a non-smoker, they're a fit and healthy young person who would run a couple of times a week and go to the gym every other day. So I think that's the message that I need you guys to promote within the community. And our best defence is the vaccine. There are a number of different types of vaccines, so if people are hesitant or if they've got allergies, talk to the people that know what the information is. So talk to your GP and talk to the clinical experts rather than relying on the media and other things that are within the Google realm, I suppose. So talk to people that know the science. I think that's one of the really key messages.
But Kieran, can I ask you on that point, there is a lot of talk around 80% whether we open the border. Do you think that people realise what New South Wales and Victoria are going through if you reopen the border at 80% and that comes up in?
I think the most important thing is that every single person in Queensland, 12 years of age or older, has the opportunity to get vaccinated. And they do now. We do have enough vaccines, so that's available. I don't think we stop at 80%. There's no intention to do that, and we can see that in New South Wales. They've got some parts of New South Wales, some areas, they're at 95% vaccination. So here in Queensland, every single year, over 95% of our kids get vaccinated. So I'm sure we can reach those numbers. And now that we've got all of that supply and we've got so many people vaccinating, we've got GPs, pharmacies, our really big clinics, I've got no concerns that we won't be able to meet it.
Have you got modelling that suggests Queensland's vaccination rate is falling off or will fall off at 70 or 75%? Is that the reason for the advertising push?
Oh no, we are starting to see that the people who really wanted to get vaccinated, who are writing to me all the time saying when was it their turn and why weren't they a priority group, they've had the ability. So now we've just got to get the people who are less aware of the need to be vaccinated, because today in Queensland, other than masks, and that's only in the southeast corner, there's very little change to what people would see as their normal way of living. So we've really got to get the message out there that we want people to be, I want people to be vaccinated before the virus arrives, not when it's arrived. It's too late then, because it takes 5 weeks from when you get your first dose of Pfizer, second dose at 3 weeks, and 2 weeks after that before you're fully protected. So I need people to have their vaccine 5 weeks before the virus arrives, and that's too hard to predict. So the best way of dealing with it is to everyone go and get vaccinated now.
Then in terms of the NRL Grand Final next weekend, is there any special provisions put in place for that will change between now and then about masks?
No, so the current situation is I want people to wear masks except when they're seated. So once you sit down, whether it's in a facility like this, whether it's at the football, in a cinema, once you sit down you can take your mask off. You don't have to have something to eat or drink. So that was the last phase. You could only take your mask off when you're eating or drinking. Now, once you're seated, you can take your mask off. And of course outside there's very few spaces that you need to wear a mask, unless you can't socially distance. If you're in a public transport queue, for instance, pop your mask on. But always just keep it with you, just so if you end up in a situation that you feel unsafe or you can't socially distance, you can pop it on.
Yeah, one last one from me. There's obviously been a lot of furor over event articles yesterday about people going outside of Queensland knowing the risks. Do you agree with those people's sentiments that they find that a pretty hard thing to swallow?
I think it's really important that people make informed choices, and people make choices in their lives every single day. As long as they're informed, then we'll work with the choices people make. But sometimes if you make certain choices, you do make things more difficult. But as long as you understand the choice you've made and what the consequence is, then you've made that choice.
In relation to, sorry, Jamie, can we just let Josh, Easy Times have been very good to us. Josh, did you say a couple of things and then we can
Hey guys, my name's Josh Collins. I'm the General Manager here at Easy Times. I think I just wanted to say from the industry that, we really want to go back to welcoming the community into the venue with open arms. We want to hug and high-five our friends and family again. And really, I think from the industry's point of view, we want to be able to visit our friends and brewing, colleagues in Newcastle, Sydney, Melbourne, and so on and so forth, and really be able to help grow our young, new business that we've opened during the pandemic. So really, from the industry's point of view, we just want to see everyone go out and get their schooner licence so they can come back to the pub.
Have you taken, even though we've got such great COVID numbers, are you still coming back to where you used to be?
Look, we actually opened during the pandemic, so for us there is no normal, and we've had to adjust with things as they've arisen throughout the pandemic, and through the guidance and help from the state government, we've been able to, basically form a solvent business during this time.
Very good.
The Premier has put a lot of emphasis on the next National Cabinet meeting and the Doherty modelling that will come out of that. But isn't that just sort of further preliminary modelling, and it won't be sort of definitive about what that trigger point is for something like the border reopening?
Well, we'll wait to see what it says and how definitive it can be. Obviously, we'd hope it was as definitive as possible, and that will inform the advice that Dr. Young gives us and the decisions that we make here in Queensland.
But in terms of that trigger point, that target, potentially, isn't it the case that we won't necessarily have a number by next Friday?
Well, look, it's never been the case that modelling pointed to border restrictions at all. The previous versions of the modelling related to when other restrictions would apply, the kinds of restrictions that are currently in place in New South Wales and Victoria, and when they could be lifted. So, look, we'll look to that advice. No doubt it will be iterative. We'll continue to get more and better modelling as the data improves. I think the Doherty have even indicated that they've had new information come to hand about the Delta strain and about how it spreads and how it affects people, and that all gets fed into this this modelling. It's not actually anything new. I think the first set of modelling we got was in February, March last year. So the scientists behind this have a lot of information to hand, but they continue to improve and refine it. Sorry, Jamie was sorry.
Just ask you to respond to what the Prime Minister said today. He made the point that 80% of the states should be open. Why can't you give a commitment reason why?
Well, first of all, that's not what the National Plan ever said. It's not what the National Plan ever said, but it is what the Prime Minister has continued to restate the plan said. I find it, pretty incredible. I mean, this bloke is the master of distraction, isn't he? You've got 9 people died in New South Wales from this virus today. You've got diplomatic incidents with Paris. He broke up with France by text message. You've got him being rebuked by the European Union. You've got a trade dispute now provoked with China. And he's on TV, national TV from the US, talking about what should happen in Queensland in 90 days' time. So all of that, and he's managing to distract the national debate with some discussion about what should happen in Queensland in 3 months' time. Frankly, I think the Prime Minister should be more focused on the health and well-being of people in New South Wales and Victoria and on international affairs than what might happen in Queensland in a few months' time. This bloke should focus on his job. Diplomacy is his job. International trade is his job. Vaccination should be his job, but we're doing it. Quarantine should have been his job, but we're doing it. Keeping COVID out of New South Wales was his job, and he failed at it.
To those businesses saying Gold Coast are doing it really tough, can you be definitive about what it will take for the borders to open up in Queensland? Are we talking about 90% vaccination? Can you give us some definitive benchmarking of what it will take?
Well, what we said is it will depend then on what the situation is here and the situation there, and the situation in terms of number of cases, number of hospitalisations, number of people in ICU, and number of people vaccinated. So there are more than one variable. I know that the Prime Minister, with his constant attempts to distract from his own failures, wants to boil this down to a simple number, but it's not that simple, and it's misleading people to tell them that it should be that simple.
Ask people to come out and get vaccinated and to continue to bring the routine. When do you think you'll be able to tell Queenslanders when you sort of draw at what point will you tell them if they can see their loved ones for Christmas?
Well, most of this discussion is about restrictions other than the border. And so that's what all of the modelling was based on. And that's because our 2 most populous states are pretty much in lockdown. And so they are looking at those thresholds for when they can lift their restrictions. Most of our restrictions here in Queensland are already lifted. And I hope that they stay lifted, but that could change. That could change, and then we will look to those thresholds for lifting restrictions. But I don't think Queenslanders want to just give in this close to the end of the pandemic. I don't think Queenslanders will want to let COVID in for Christmas if we don't have it, but New South Wales still does. And so they're the considerations that we will need to make, because we are in the very fortunate position of not having the virus here right now. 17 cases right now, compared to more deaths in New South Wales in one day than Queensland has had throughout the entire pandemic. And so, look, I understand that the LNP and the Coalition and Scott Morrison would prefer that everyone was talking about Queensland's border reopening in coming months than their own failures across a range of fronts. But people shouldn't fall for that, and that's not the conversation that I think is happening out there in the community. It might be the question we keep getting asked at these press conferences, but it's certainly not what people say to me when I walk down the street.
What about the reopening today? What about the announcement today by the FDA? Victoria has 779 cases reported today, and yet on Wednesday, Mr. Andrews says that they'll be lifting some of the restrictions. How do you
That's right, Jamie. That's right, Jamie. They are nearly at the point of vaccination levels where they can ease some of their restrictions. For example, beard trimming will be allowed again. That's the kind of restriction that is being eased at that point. So I think focusing here on Queensland where those kinds of restrictions are a distant memory for us, is attempting to take a debate that is happening in New South Wales and Victoria and apply it here in Queensland. Look, I understand the other elements of the first stage of the roadmap are people can have more people in their homes again. Outdoor venues can have more people there. Well, we already have all of those and many, many more. In fact, after that stage of easing, they will still have much stricter restrictions than we do here in Queensland. And we don't have a fixed date for when those lockdowns in most of New South Wales and most of Victoria will end. And so a lot of this discussion about the Queensland border is pretty academic, because the people that you're saying should be allowed across our border are currently locked down in their homes by their own state governments. And so the Queensland border should be relatively hypothetical, because most of the people in New South Wales and Victoria shouldn't be travelling to Queensland anyway.
Can we get some of the latest numbers out of you, Deputy Premier? Do you have figures for how many genuine residents of Queensland are currently trapped interstate and can't return for whatever reason? And second to that, how many beds are becoming available on a daily basis in hotel quarantine for those stranded Queenslanders?
Well, certainly we have data available about the number of people who have applied to travel here. We had to put that system in place because there was a large variability and unpredictability about the number of people who would arrive each day. And so that system is largely about traffic control. It's about making sure we know how many rooms we need each day, because we know who is arriving each day. So yes, that is available, as well as the number of rooms that become available. I don't have that data to hand. Usually the police representative at the press conference does have that data available, and I'm sure will be here tomorrow. But there continues to be a large number of international arrivals within the cap, a large number of international arrivals permitted to travel by the Morrison government outside of the cap, sometimes twice as many, and a lot of people coming to Queensland from New South Wales or Victoria, whether they have been resident of Queensland before or whether they intend to take up a residency in Queensland. And so we continue to manage that. We don't control the international arrivals, so they come out of our hotel availability first, and then whatever is available of other rooms get provided to those either returning or relocating to Queensland.
So you're not able to, say, put aside a specific number of quarantine beds specifically for those genuine residents returning? Like, for example, 50% of the total daily bed capacity, you're not able to put those aside?
Look, it does tend to run at roughly 50%, but it is not legally possible to discriminate between those who were resident and returning versus those intending to take up a residency, and so there is not that ability. What the system does is, first of all, as we say, we have to take all of the people that the Morrison government lets in over and above our international arrival cap, and there's a variability about that, but we have to accommodate them first, and then what is remaining of our hotel quarantine capacity gets provided to Queenslanders, first to those who have exemptions and are processed through the exemptions unit, so that's where we deal with those compassionate cases, that kind of thing, and then according to those who are waiting for their permit to travel.
Deputy Premier, can I ask you, is the real reason you're concerned about tying a figure to the border the fact that the hospital simply won't cope if we end up like New South Wales, Victoria?
Oh, I'm very sure our hospitals will cope, but why would you wish that upon them? I mean, you've just heard from... Yeah, I'm being... No, our hospitals will always cope. But the more stress we put on them, the more stress we put on our health workers. You've just heard from a nurse, a frontline nurse, about her experience in a hospital, and our hospitals will cope just as they are in New South Wales and in Victoria. But why would you wish that upon them if you didn't need to? And if we have to, they are very, very well equipped. We've had a very long time now to put those contingency plans in place. But why would we choose to do that Why would we choose to do that if we don't have to? And so that's largely the thinking now. Let's get as many people vaccinated as we possibly can before the virus gets here, so that people like our frontline health workers don't have to go through what they're going through in New South Wales and Victoria. I know it's not getting a lot of coverage up here. But you've got hospitals and health workers who've been under stress for nearly 2 years, now facing the worst of the pandemic. Let's not forget, for Australia, for the Australian experience, this is the worst it's been. But of course, here in Queensland, our experience is very different.
Deputy Premier, a QUT professor has raised concerns about ventilation in schools, and she says the government hasn't done enough in that space. They rely on natural ventilation. What is the government looking at doing in terms of ventilation in schools?
Well, first of all, let's not forget that we are in the process of air conditioning all of our schools, a commitment that we made and that is progressing very well. I understand the Education Department has work underway to identify whether there is additional ventilation required, and of course, anything that we need to do to keep our children safe at school, we will do.
Deputy Premier, just unrelated question. An NRL footballer's got in trouble with the police at the Gold Coast overnight. Are you frightened that may take away from what should be a filled with a big party pre-grand final weekend coming up?
I'm not across the details of that particular incident. I just encourage people to focus on what a great spectacle having the Rugby League Grand Final in Queensland will be. I watched that Storm Panthers game, and who would have thought the Panthers would keep the Storm out the way they did? It just bodes really well for a cracker game next weekend.
Disappointing though, this tracks what should be a really filled with weekend Christmas.
Of course it is, but I'm more focused on the fact that here in Queensland, after 114 years, we finally get to see a grand final.
Are there any contingency plans if there's an outbreak here?
It's the same as it's always been. If there's an outbreak, we'll respond to it, and we'll respond based on the information that Dr. Young has to hand. We have the tools. We know what to do, depending on how severe the risk is. Thank you.
All right. Thanks, guys.